Hi, my name is Tracey Podolsky, and I have been a physical therapist and lymphedema therapist for over 20 years. I have had a private practice in treating conventional lymphedema um, since 2005. And it is now 2022, and we are post-pandemic. I've moved my practice twice in the last 3 years, and I am transitioning into what I call functional lymphedema therapy. So I wanted to produce a video because I get so many questions, and although they are all so amazing and the questions are valid, and I really enjoy talking with people, knowing my own strengths. I am a relationship builder, but sometimes that creates some challenges within my day. So let me explain. Because I'm a relationship builder, I like to talk. And so whether or not you come to see me or not as a new patient, I could be spending 45 minutes to an hour on the phone with you. So I would like to just clarify that new patients, not all new patients, I am able to see. And I am working solo. I used to have multiple therapists, a couple front desk staff helping me run my practice. But over the years, what I learned was that I was starting to have my own health issues because I was on the treadmill of burnout. And over the past 5 years, I've reversed a lot of things in my own health history. And ironically, I started comparing that to all of my current patients who are still coming for their follow-ups, whether it's every 3 months, every week, every 6 months, once a year. And I started reflecting on how similar other people are having the same types of symptoms. And I started prioritizing my own health first. And so although I reflect back to a busy office with 4 physical therapists treating many patients throughout the month, that is not where I am at this point. So what I call that is conventional lymphedema therapy. Conventional lymphedema therapy is called complete decongestive therapy. It's what I got certified in 2002. Yeah, it was 2002. I got certified in treating lymphedema. I was only 6 months out of graduate school at Quinnipiac University, and I wanted to learn everything. And at that time, there really were not any lymphedema therapists. And the people the gurus back then are still certifying physical therapists, occupational therapists, speech therapists. Every month, new therapists graduate from the certification program. However, the biggest problem is that going into their healthcare setting, they're not able to deliver it the way that the schools are teaching it. I could go on and on about why I think that is. And if you're listening to this video and you are a lymphedema therapist and you're not treating 5 days a week and you're not using foams and you're not seeing a person with both legs involved for an hour and a half every day, then I would like you to also reflect on why that is, because over the years, there are so many more lymphedema therapists that you have access to. The problem is that the administration or the lymphedema program does not support the pure delivery of complete decongestive therapy. So over the past 2 years, I've networked with some lymphedema therapists whom I trust and that I would refer you to if you need daily conventional lymphedema therapy. So if you have never been treated before and you have swelling, you need to get the swelling under control. There are too many, not consequences, what's the word? There are too many side effects or sequelae of untreated lymphedema. You don't want to wait on that. You want that to be your first priority. So once you get the lymphedema under control, what I've learned over the past 5 to even 10 years, and I wasn't doing this formally, but I was watching what was happening as I was sharing some of the things that I was doing for my own health and my own body. And some patients were adopting some of the same things. And their lymphedema started improving, their management. So these are people who already have been treated, who are using compression, and now are making lifestyle adjustments in order to further reduce any triggers, or even the root causes of their lymphedema. So because there aren't many people, I don't really know anyone else who's doing functional lymphedema therapy, but I am studying through the Institute for Functional Medicine. I'm one of the only physical therapists that is going through the advanced certification. Most of them are physicians that then go into doing functional medicine, and working with their patients, discovering the root cause of their symptoms or their illness. And so I would like to take my training to my specialty, which is understanding the triggers that have either caused or worsened your lymphedema, so that you need, when you make these modifiable lifestyle changes, you're able to reduce the amount of self-care that you need to do on a daily basis. Because let's face it, once you're done with lymphedema treatment, this is a lifelong condition that you individually will learn how to manage. And the management varies from individual to individual, depending on your stage, depending on the severity of your lymphedema and how long you had it untreated. Okay, so let me summarize. It's absolutely necessary for you to get treatment for your lymphedema. And let's call that conventional lymphedema therapy, which is complete decongestive therapy. You need to go to someone who's a certified lymphedema therapist. On my website, there are a few links that you can click on, put in your zip code, and find a lymphedema therapist who has been properly trained. Or you can reach out to me through the website. There's a new patient inquiry form, and the website is wyatt.rehab.com. And you could reach out to me and I can try to find you someone close to you, as close as possible. But you have to remember, there are lots of physical therapists, pretty much like a Starbucks on every street corner. But you need to go to a certified lymphedema therapist, and you need to go to a program that's going to be appropriate for you. Okay, so even though it might be a few even counties away, I remember when I first started, I had patients driving an hour to 2 hours each way to come see me. I had patients coming from all over the United States, flying in and staying at the Holiday Inn Express down the street. So let's be grateful that we have so many more lymphedema therapists who are properly trained and are really great people, and they're experienced in their craft, and they're delivering the conventional lymphedema therapy, while I can help you afterwards if you are interested in looking at some of the root causes and triggers as to why you have lymphedema or why your lymphedema is harder to manage lifelong. Okay, so what I do in a nutshell is I first look at your genetic makeup, which is done through a test called 3x4 or 3x4 genetics test. And then we look at with all of your genes and how you make up your individual makeup, which is very, very only you. You know, my 3x4 test is going to be very different from yours, very different from your spouse or your child. And we look at what foods, what supplements, and what lifestyle modifications need to be done in order for your systems, your entire body system, to work in harmony and symphony. And a lot of those lifestyles adjustments will lower systemic inflammation, which is really a lot of why some people develop lymphedema and some people don't. Or some people's lymphedema has a much harder, stubborn fibrosis, or, their onset for lymphedema was immediate, where some developed it later on. So I really, really enjoy looking at people's entire life and figuring out why people have some of the symptoms, including lymphedema. We may not be able to reverse the trauma that happened to your lymphatic system, let's say in a cancer surgery, but we absolutely can lower your systemic inflammation or modify some of the things you're doing in your lifestyle so that your hormones are balanced. That's another reason why you can have systemic inflammation, or that your glucose, your blood sugars are balanced better. So I want everyone to understand, without me having this conversation with each individual, because then I can't take the time to be with the people that have signed on to do this next step. I think of it as the next generation of medicine and therapy, is always looking at the individual and not just giving you the same cookie cutter approach. And that's why I've loved the conventional lymphedema therapy for so long, because each person, even though when I went through the certification with Steve and Gunter, I learned the basics, but then I was thrown into a program that allowed me to use my critical thinking and allowed me to understand that I can change things up within a bandage or the manual lymph drainage, depending on that individual. And by far, when you go through therapy and then you transition into garments, that transition is super individual, because everyone has different assistance, they have different range of motion and strength, they have all different aspects that the therapist then needs to figure out the best way for that patient to sustain what they've achieved during the intensive treatment. Does that make sense? So I know this video is getting to be a little long, but this is why I can't talk to every single new patient because I would just sit here all day and just be talking to everyone. And wouldn't that be lovely? If I got paid to do that, that would be my dream job, because I just love talking and I love relationship building. So I invite you to reach out to me with my new patient inquiry. Please be as detailed as possible as to what you're looking for. Know that I am here to help you. But if you do need to receive intensive treatment, if you have never been treated for lymphedema before, you really need to be referred to someone else who's doing the conventional lymphedema therapy daily. So I hope this helps make sense of what Wyatt Rehab is transitioning into. I'm super excited to work with any or all of you in this next phase of functional lymphedema therapy.